Hello, my name is Cindy Partida, and today we will be talking about a neurological based behavior, reactive attachment disorder. Now, in order to understand reactive attachment disorder, we need to understand the importance of healthy attachment. It is through attachment that, with a loving child and a protective caregiver, that a child learns to love and trust others, become aware of others' feelings and needs, regulate their emotions, and develop healthy relationships and a positive self image. Therefore, the absence of emotional warmth and attention during the first few years of life can negatively affect a child's entire future. This is a great picture to show the attachment cycle. If a baby has a need, the baby will often cry, and the need will be met by the caregiver, therefore developing trust. But what happens when the baby has a need and the baby cries, yet the caregiver does not pay attention to the baby? For example, might leave them in the crib for an excessive amount of time, doesn't change their diaper, different things like that. The child learns that they can no longer trust their human survival instincts of crying and be able to get that emotional warmth from their caregiver. Therefore, they form mistrust. That leads into a child developing reactive attachment disorder. So, reactive attachment disorder, also known as RAD, is a condition found in children who may have been received grossly negligent care and do not form a healthy emotional attachment with their primary caregivers. Usually, this would be their mothers before the age of 5. And this can occur for many reasons. There might be a persistent disregard of the child's emotional needs for comfort, stimulation, and affection. Back to that image in the previous slide, going back to a child cries because they have no use of language. They might cry because they want to be held, cry because they want attention, cry because they want to feel loved. But if that action is not received by a reaction by their parent, it can lead to reactive attachment disorder, as well as persistent disregard of the child's basic needs. They also cry because they might be hungry or have a wet diaper, so they're ignored on those deep levels. It can definitely have an effect with them. Also, another reason might be a repeated change of primary caregivers. Therefore, this child is unable to form stable attachments. This can happen, for example, with children that are placed in multiple foster care homes, or let's say a mother is dating multiple men and doesn't form good relationships, and lots of boyfriends are coming in and out. That might have an effect as well. There are two types of RAD, which is really important to understand because it does not look the same in each child. One is being inhibited, which means that the child is detached, they're unresponsive or resistant to comforting, or they might be holding back their emotions and very withdrawn. While a disinhibited student might really not be very eager to form relationships, even with unfamiliar people, and inappropriately they select who they attach to. So, this might be a child, for example, that once someone walks in the door, they might not even know them, but is extra clingy. Off the bat, just forms relationships with everyone. Oh, I want to be your best friend. Oh, you're my best friend. And just very clingy and needing that affection. That would be the disinhibited child. I thought this was a great quote that I got from an article from Schwartz. It says, schools themselves present unique challenges for children diagnosed with RAD. While the mission is to educate students, children with RAD are primarily concerned with internal issues of safety, security, and trust, and the need for survival, given their history of maltreatment, and it can be overwhelming, leaving them unable to profit from a learning environment. The child's preoccupation with survival and acute hypervigilance works against the organizational skills necessary for school functioning. This is really great because this even relates to Maslow's hierarchy of needs. If A child does not feel safe, secure, and those basic needs are not met, they are unable to go above and beyond and focus on classroom material or anything else that needs to be done with organizational skills in order to function well and survive in the school environment because they are missing out and face challenges with those basic attachment and healthy attachment forming relationships. So, what does a child with RAD look like in a classroom and how does it affect them? So, children might be lack interest in playing with toys. They might have poor eye contact. Maybe they don't trust individuals, so looking at them in the eye, they don't feel comfortable with. They might show aggressive behavior towards peers. They also might observe others closely but doesn't really engage in activities. So when there might be assignments, they might be standoffish and not really want to engage. They're probably not trusting. Is this a safe environment? Is this a safe activity? And they are not. Their sense of trust is really low, as well as it can lead to being unwilling to ask for support or assistance. So, since they might not have a sense of trust in their teachers, they are unwilling to ask for support because when they were growing up as a child, when they did ask for support, it wasn't met. So they feel like that might be also be related to the school area as well. They have no impulse control, and there also might be some power struggle with teachers, and I'll go more into that. Some classroom challenges are group settings, especially because building that sense of trust and security with one person is difficult for a student with RAD, but building it with multiple people at the same time can really cause anxiety, and they might not even be able to process the interactions. It might be so overwhelmed with the relationship building of a group assignment that they can't focus on the actual classroom assignment. They also might try to prove that the teacher is not in control, and it can cause increased tension. By them not having trust in the teacher, they might question, and if a teacher is unaware of RAD and where it stems from, it might also increase that sense of tension and anxiety within a student. Also, they have a large sense of needing gratification immediately. So, if they do something well, in order for them to feel supported, they really need to be praised immediately, or else it can increase feelings of rejection, which can be hard within a classroom that's large, as let's say filled with 25 to 30 students, because not every student has one on one attention from a teacher. So, their need for gratification might not be met immediately. Some strategies that can be used by counselors and teachers are to be able to model and teach appropriate behavior. Since they are not developing healthy relationships at home, it's important that in a school setting we teach children how they should act like in a classroom. It's also important for counselors and teachers to be predictable, consistent, and repetitive. And that's probably the biggest thing. Keep to your word, be predictable, have a schedule because that makes them feel more safe and secure because they know that they can depend on the teacher following through with the schedule and it makes them feel comforted. Also, try avoiding struggles. So, if there is power struggles, maybe pull them aside, talk to them very matter of fact. Don't really try to regain power because that might just increase their anxiety level. Also, break assignments into manageable tasks. This is really important because, as previously stated, students with RAD might not be willing to ask for help. So breaking assignments into small tasks so that a teacher can give little tasks at a time would be helpful instead of doing a complex task and a student with RAD might feel very uncomfortable asking for help. So it's better just to break it up into pieces. Also, identify a place that the child can go when they need to regain composure and maintain emotions. Because they're unable to regulate their emotions, It's nice to have a safe place in the classroom where they can regather themselves and be able to refocus on the material in the classroom. Here are some of my references that I use. These are great resources for you to learn more about how RAD affects their school readiness and school functioning, as well as the different types of reactive attachment disorder. I hope that you learned a little bit more about RAD today and how you can effectively help out students with RAD in the classroom and counseling setting.